video, I will discuss fluoroquinolones. These are very widely used antibiotics used in urinary tract infections, respiratory tract infections, GI infections, and skin infections, etc. These are synthetic broad spectrum antibacterial agents and are derived from nalidixic acid. These are derived from nalidixic acid. They inhibit the bacterial DNA replication. We will see it in the mechanism of action. So these are classified into 4 classes. First generation, these are non-fluorinated, and these include nalidixic acid and oxalic acid. These are very rarely used nowadays. Then second generation, ciprofloxacin, ofloxacin, norfloxacin. Ciprofloxacin is mostly used for urinary tract infections, and ofloxacin is mostly used for pelvic inflammatory disease, etc., and also for GIT infections like spontaneous bacterial peritonitis. For its prophylaxis, we use ofloxacin and norfloxacin, etc. Then we have third generation fluoroquinolones. These include levofloxacin, ciprofloxacin. These are also known as respiratory fluoroquinolones because these are mostly used in the pneumonias. And the fourth generation, these include moxifloxacin and gemifloxacin. Moxifloxacin is used in respiratory tract infections, also in skin infections, and it should be remembered that it is safe in CKD, so it can be given to the patients who have CKD. Mechanism of action: these drugs inhibit DNA gyrase, that is topoisomerase 2 and topoisomerase 4, and in this way inhibit the DNA formation, and therefore when they prevent DNA supercoiling, in this way inhibit replication and transcription, and therefore lead to bacterial death. So these are bactericidal. They actually kill bacteria. Spectrum of activity: these are active against gram-negative bacteria. These include Enterobacteriaceae and Pseudomonas, etc. These gram-negative bacteria are responsible for certain infections, like E. coli is responsible for UTIs. So E. coli is responsible for diarrhea. So against these infections we can use these quinolones. So quinolones are active against gram-negative bacteria, gram-positive bacteria, especially Streptococcus pneumonia, and for this we use third generation cephalosporins, mostly like levofloxacin. So it is active against gram-negative bacteria, gram-positive bacteria, and also against atypical organisms. So when atypical organisms like Mycoplasma, Chlamydia, Legionella, these all mostly cause pneumonias. So when they cause pneumonia, then we use either levofloxacin or moxifloxacin, and in this way we treat pneumonia caused by these atypical organisms. So it has a broad spectrum. It is a broad spectrum antibiotic: gram-negative bacteria, gram-positive bacteria, and atypical organisms. What are its pharmacokinetics? It can be given orally or intravenously. It has good oral absorption. It is widely distributed in urine, lungs, and prostate. So infections of these sites can be treated by using fluoroquinolones. And mostly these are renally excreted, but moxifloxacin has hepatic clearance. Therefore moxifloxacin is safe in kidney disease. So if someone asks you to which fluoroquinolones is safe in kidney disease, you can say that moxifloxacin is safe in renal disease. Clinical uses: first one is, as I have told you, urinary tract infections mostly caused by Escherichia coli. These are treated by ciprofloxacin. Norfloxacin can also use levofloxacin for UTIs. Then respiratory infections like pneumonias are also treated by fluoroquinolones, and these are mostly treated by respiratory fluoroquinolones like levofloxacin and moxifloxacin. Gastrointestinal tract infections like traveler's diarrhea caused by E. coli and typhoid can also be treated by using quinolones. Typhoid is now resistant to these drugs because these drugs are very widely used and therefore resistance is developing. Bone and joint infections and anthrax prophylaxis, these are all the indications for fluoroquinolone therapy. Adverse effects: gastrointestinal upset, mostly seen with most of the antibiotics, nausea and diarrhea. CNS effects: dizziness and headache. But the most important adverse effect that is seen with quinolone is tendon rupture. Tendon rupture, especially Achilles tendon. So it can lead to tendon rupture. QT prolongation is the most serious adverse effect seen with the quinolones, and moxifloxacin is the drug that causes the most cartilage damage. So you should avoid in children and in pregnancy, because in children and in the fetus it can lead to cartilage damage. Therefore fluoroquinolones are contraindicated in children and in pregnancy. So contraindications for fluoroquinolones are pregnancy, lactation, so lactating mothers cannot be given these quinolones, and also children, because in pregnancy and in children it leads to cartilage damage. Therefore it is not given in pregnancy and children. And also, if there is history of QT prolongation, then there is risk of QT prolongation with fluoroquinolones leading to torsades de pointes. Therefore, these drugs should be avoided in known cases of QT prolongation. Drug interactions: antacids and iron decrease the absorption. Theophylline and warfarin toxicity is increased with fluoroquinolones. So fluoroquinolones are, when given along with theophylline and warfarin, then the toxicity of theophylline and warfarin are increased. And QT prolonging drugs should not be given along with levofloxacin or moxifloxacin, because there is a high risk of QT prolongation when these drugs are combined with other drugs who have ability of QT prolongation. Therefore these should be avoided with those drugs. So this is all about fluoroquinolones.